Tabitha, I appreciate your discussion video of psychopathology in the Christian perspective. I found your video interesting and engaging. This is the second class that I have been a student in that requires discussion videos. Your video is the first that I have seen a visual presentation for while you discuss your topic, so wonderful job. I want to share a little bit about myself. I'm studying school counseling at Liberty, but utilizing this class as one of the counseling electives to work towards the LPC requirements. Your presentation reminds me of educational settings such as a teacher or a school counselor, or even a mental health and research national conference that my undergraduate psychology professors attended, or I was even in a research symposium that I participated in while in undergraduate school as a psychology student. I will reiterate, wonderful job. I was very impressed with your presentation. I also utilized the Buttman and Yarhouse article from 2014. I found the article very informative and interesting. When you discuss the stigma of mental disorders, that is a concern within the field of mental health. I have noticed a gradual shift in society towards inclusion culturally of knowledge and support of those with mental illnesses. Despite this, I think the attitude of society towards mental health, along with governmental initiatives for mental health, could still improve greatly, in my opinion. I agree limiting the client to one treatment plan and one diagnosis and only pushing prescriptions and not recommending other treatment plans or counseling can definitely limit the client with their choices. But I would like to share a little bit about myself and then talk about an article relating to that. I work in a pharmacy as a sales associate. Discussion with customers about what can be covered by insurance and what cannot is an ongoing and prevalent topic where I work. I think of the same issue with clients for counseling who may desire more sessions of counseling, but their insurance may not cover the extra sessions. I realize pro bono, or in other words, offering free counseling services to the community or a sliding scale may help some clients, but as a counselor or even within a pharmaceutical setting, it can be equally frustrating when counseling or medication is life-saving and makes a difference in a client or a patient's life, but it may not be covered by insurance for the patient or the client. According to Fullen, Wiley, and Morgan from 2019, this article discusses Medicare with mental health coverage gap, how licensed professional counselors can navigate the Medicare ineligible provider status. The interview was with 9 mental health professionals, and it discussed that eligible mental health professionals are able to provide counseling to older adults who are Medicare patients. These professionals include licensed clinical social workers and advanced private psychiatric nurses that are eligible for master's level providers for mental health care through Medicare. Licensed professional counselors, or LPCs, or licensed marriage and family therapists are not eligible to provide mental health care under Medicare. And the article discussed that this created a gap with providers for older adults who have Medicare. There is a quote from the article: despite current Medicare reimbursement restrictions, Medicare beneficiaries are likely to seek out services from LPCs. As cited in the article, past research demonstrates that Medicare eligible populations respond appropriately to counseling. Fullen, Lawson, and Sherma found that over 50% of practicing counselors had turned away Medicare-insured individuals who sought counseling services. 40% had used pro bono or sliding scale approaches to provide services, and 39% were forced to refer existing clients once those clients became Medicare eligible. End quote. If the patient has supplemental or private insurance, the article did talk about that they may utilize this for coverage, but the patient has to wait for the proof of denial from Medicare coverage before the secondary insurance applies. So this can be equally frustrating, and just navigating that, like, as the counselor and the client together. But going back to the counselor-client relationship, focusing on that and working through that, then the counselor and client can definitely navigate the insurance part of that. So thank you.